Lawrence Brown, next question I wanted to pose to you, because you say that there should be a state of emergency declared in Baltimore. Tell us why.
Absolutely. You know, when you look at that Maryland Department of Environment data, you see that since 1993, the number of children or the number of cases where children have been poisoned over 10 micrograms per deciliter of lead in their blood amounts to 65,650 cases where children have been counted as poisoned over that threshold. And we've had in our city recent examples of children who were poisoned at levels over that. Freddie Gray was poisoned at 36 micrograms per deciliter of lead in his blood. Corinne Gaines, who was killed by Baltimore County Police, but poisoned in Baltimore City, she had 12 or 22 micrograms per deciliter of lead in her blood, depending on which source you read. And so, these impacts that have been mentioned are very disconcerting. Lead impacts everything from cognitive impairments, behavioral issues. It creates that. The propensity towards violence is elevated. It's associated with ADD and ADHD. It's even associated in some studies with elevated levels of depression disorder and panic disorder. And so when you've had such a large number of children who are now adults, that sit before us, and we've never tackled this in any sort of meaningful way, especially their medical care. To look at their medical care is something that we really have to look at. And not only do we have that crisis, which is subsiding, but it's the low-level lead poisoning below 10 micrograms per deciliter of lead in their blood, where we could have as many as 200,000 children who've been poisoned since 2000, or 200,000 cases where that's been recorded according to MDE data. So this is why there should be a state of emergency. Like the lead said, we have neighborhoods in Baltimore that have higher rates of lead poisoning than Flint, Michigan. We need a state of emergency so that we can tackle this and get rid of lead in our environment.
Is there any other precedent for cities or even states declaring states of emergency behind lead poisoning in addition to Flint?
Not to my knowledge, but I don't think that should be any sort of, preventing factor. Public health is supposed to prevent disease. And right now we're waiting until children are poisoned by lead to kick into gear. And I think that's it's a criminal strategy. It's an inhumane strategy. We're putting children at risk for living way beneath their potential. It's a sort of slow violence. This fast violence in our society is very spectacular. The police brutality, the murders, that gets all the attention. But lead poisoning is a form of slow violence that the impact we may not see for 20 years. And I think that's something we have to really pay attention to and not just be attracted to the fast violence that sort of grabs the everyday news.